We have like several different services we provide in our management company. The idea behind the management company is to support the franchise owners that are coming in under us or through us, is a probably better way to put it. So that way, not only do you get corporate support, but of course, as we all know, like with corporate support, it's very thin because they have so many different franchises to handle, and they only have so many people. But within the TEDCare umbrella, we also will be able to provide more support, um, specifically for the franchise owners that are within our umbrella, which you would fall under that category. So that's the purpose of our management company. Is to help all the franchise owners that we have. Now, currently, we have two different services that we have. We have a starters agreement, like a starters package. What the starters package entails is we will help you, and then this will probably pertain to you because you don't have a location yet. So we want to find a location first, and then your DB will be formulated based on where that location is. So that's the first thing we do. Now, in formulating that location, right? So that's what we call what Anton was deeming as phase one. In that phase one, we would look up demographics because when you have a location, you want to try to make sure that you're not getting a location where there's a bunch of wealthy people with a bunch of fancy cars and million-dollar homes, because the chance of finding someone that's under Texas Medicaid is very slim in that demographic because um, Texas Medicaid is designed for people that are on low income, below a certain threshold of income. And a lot of those people that are on low income come up from a certain demographic and socioeconomic status. And there's data to back that we can research for certain areas that we can deem as a good area to kind of focus on for your location. So what we do, like in phase one, is we kind of research the demographic socioeconomic data for up to 3 zip codes. So hopefully within those 3 zip codes, there's an area that you feel comfortable with, like, okay, that data makes sense. And then we would look for office space in that location. Prior to doing so, we would make sure with corporate and some data we have with a not so updated map, but it is the closest thing we have to make sure there's no one else getting a location in that area before we proceed. So then at that point, we look for locations. As far as looking for locations, there's various ways of going about it. Like, for example, we have two locations we're about to open now. They're both completely different types of locations. One is your standard office space, like a big building with the office suites inside. We have one of the suites. It has four rooms in there. The standard location protocol that corporate wants us to follow typically is one reception, 2 rooms. Um, Corporate has modified that to where you can do one reception, 1 room. They've made that exception for at least one franchise owner. I would still look for one reception, 2 rooms, just to be on the safe side. Um, that way you have a reception area and then you have a space for your admin manager and the QMHPs or sessions. If so, most of these sessions will not be done. I'll say 10, less than 10% will be done in your office space. Majority of these sessions are done in the client's home or in the schools or an outside venue because the idea behind our services is to be in the environment of the client so we can best understand their environment and then provide services that cater to them.
Excellent.
So the office space is generally used for number one, Texas Medicaid wanting a physical location that they can deem as, okay, this is where you're providing services. And number two, a place for your admin manager to actually work out of, as well as in case sessions need to be done, there's an area to do that. And then in the future, when we bring substance abuse in, that will require an in-house space with certain square footage to allow clients to come in and get substance abuse services.
Mhm.
Um, so typically one reception area, 2 rooms. They have to have locked offices for HIPAA compliance and security. So one of our office spaces is just like that, your traditional office space. Our other location is actually in a church. Anton may have told you about this. Um, all 100% kudos to him. It was all him in terms of finding that location. but it turned out to be like such a blessing because anytime you have like a nonprofit organization, a church, a community center, and your office is in there, you're within a network right there already built in that you can build off of. Because the type of clients we're looking for are going to be walking through that door on a regular
Mm.
basis. So then you have people there already that will help you kind of, boost up the clientele over time. Versus like if you're in a traditional office setting, there's going to be a lot more community outreach that needs to be done. Not that it wouldn't be done in a church or nonprofit location or community center, but you would still do that type of community outreach. However, you would have more people there that you'll be able to collaborate with, network with, people coming in the door that might fit the bill in terms of the type of clients that would qualify for our services. So, so as far as looking for an office space, we can go the traditional route, which is the easiest way to find an office space. Or we can also look into churches and nonprofits, which are a little bit harder to get into because, you have to really network a bit more to find those type of locations. But if you get into one of those, it's a gold mine because the network that you achieve from that is tremendous. So within phase one, we would to do the demographical research, find three locations that you can take a look at with the address, the square footage, the rent, and whatnot. We would help you find furniture for those locations. Um, in most cases, if it's in Dallas, since I'm not in Dallas, we would find someone there that can coordinate with the delivery of the furniture, but that's not going to be difficult. We can figure that out. Um, it's still doable. We as far as finding furniture, we can Google and find furniture that's used that still looks good. Like I know our furniture was used. We got it for like $1,500, and it looks some of the lounge chairs that we have actually came from a bank, Wells Fargo. So they look really nice. So you don't have to pay $5,000 to $10,000 for new furniture. You could take the used ones and it still would look good. So so we would assist in that. And then the other aspects here, like helping you look at the lease, compliance checks, the Google My Business setup. So that's phase one, is getting a location set up. We cannot do anything as far as hiring anybody until you have a location set up. So goal one, location. Goal two, secure. When we find a location, confirm it with corporate that no one else is around that area for a certain number of miles. Then secure the DBA, which corporate would provide you with what the DBA would be. They configure that. And then now you have your location secure. Then we look at furnishing the location, setting up the signage, things like that. And then we can look at phase two. So phase two is going to be now the dynamic that you guys, that the barber you're going to have is that you're not any different than Anton and Eric in the sense that they both do not live in Texas, and a lot of our franchise owners do not live in Texas. I would say it's maybe not 50%, but it's a pretty decent percentage. If Anton and Eric, who are going to be, the owners of 16 to 18 franchise locations and more, are able to do this without living in Texas, then of course you can do that living in New Jersey. Okay. But all that being said, is Anton and Eric have me as their eyes and ears in terms of manning these locations. So one of the most crucial decisions that you're gonna have to make is getting an admin manager that's going to handle the location that that you end up having. Okay. So the admin manager, the best way to view this, the admin manager is the CEO of your location. Now we're not talking about like a massive hospital here. We're talking about, a three-room office that's going to the person to work out of that at the most you probably have at max capacity, you probably would have no more than 20 employees, including your QMHP contractors. So if you're admin manager for the one location, probably 10 QMHPs at capacity. You're going to have your clinical associate that does the assessments. That's going to be provided by us if you do the share model. And then definitely you'll be using our clinical supervisor because that's the person that signs off on notes. Okay, so if you add that all up, you're not even looking at 20 people at your location, just to give you a perspective there. So when we think about the admin manager is going to oversee the daily operations of your location. So we're talking about things like little things like supplies in the office, to getting, making sure that everything's kept well in the office, to scheduling the initial assessments. So they'll do scheduling, they will do client intake, they'll reach out to the clients to make sure everything is running smoothly initially, so they can get qualified because they do have to be on Texas Medicaid. That's very important for you to understand that if they don't have the right insurance, they don't qualify. And in a lot of cases, we would either have to get them the right insurance, or we have to refer them off to someone if they have private insurance to another entity. Um, Now, in that case, we do form partnerships, and with organizations that will also be getting Texas Medicaid clients that they can't service, in which case they refer them to us.
Also, like a reciprocal relationship.
Correct.
Okay.
Exactly. Right. So we're talking about with an admin manager, we're talking about scheduling. Billing is very important because um, billing for the services that we provide so that we get reimbursed from Texas Medicaid. So reimbursing meaning that's how you get paid and that's how you make revenue, right? So the revenue is based on the clinical supervisor signing off on the notes and the sessions being done, the assessments being done. Those are signed off, and then Medicaid over a certain period of time will reimburse for those services that are provided. So that's how you generate your money. Um, so that's just a nutshell of what the admin manager. We do have a whole job description that we can go through some other time that will lay out more details on what they do because there's a lot more. But in a nutshell, I just want you to understand that the admin manager is the eyes and ears of your location and would work directly with you, Barbara, in terms of what is going on with the location on a day-to-day basis. It has to be regular communication with that person. So whoever we bring on for you needs to be someone that you get along with. Just like Anton and Eric, I talk to them every day and we get along very well. Even in times that we don't agree on things, we always get along.
Uh-huh.
Mhm.
Okay,
That's
so
Yeah,
good.
that's
usually Asif's always right.
That's another point. Like Anton, he's kind of serious here, but he's also joking in a sense. But that is important what he said because your admin manager does need to be right majority of the time. You definitely don't want someone coming to you telling you what should be done, and you're the franchisor, but you're not the expert. So you want to hire an admin manager that knows what they're doing, so that they can take what's the right way to put it? So they can run your business and you be able to trust them in what they're doing.
Yes.
But of course, you still need to provide them guidance in terms of, okay, what's the cost for this? They want to implement something, they want to do, they want to hire the next QMHP, make sure that they're showing you why, right? So you've run a business before, you currently run a business. So anytime like you need something done or you need to add the next employee or you need to hire the next QMHP or something is not running right, they should be able to provide you a layout or a report on what's going on and be able to do so in a concise manner so you can understand what's going on and be able to tell them yay or nay based on the information that they're giving you.
Hmm.
Because the final decision is still yours. You're the franchise owner, but you definitely need someone, in your case, definitely, Barbara, I would say someone very seasoned, not green or inexperienced or wanting to learn on the go. For you, that would not be a good fit. It has to be someone that can say, you know what? I know what's best for your location,
Right.
for you. So there are three different ways we can do this. Based on what Anton is saying, I think we can go with a shared model, but I'm going to quickly tell you what these three are. Um, we do have a franchise owner currently that already has their admin manager. They decided that they wanted to pick their daughter. Their daughter may not be on paper the most qualified, but I would be training her until over the first month or two to where she will be up to speed on how to run the location. If you did have someone in mind that you feel is qualified, of course they should be in Texas. then we could do option one, right? If you don't, then what we do is we look at option two, which is hiring an admin manager exclusively for you, which means, and we do have a franchise owner currently that we're doing this for. We post the job ad, right? So we post the ad, and you kind of go into this part here. So minimum pre-screen, 5 pre-screened candidates, right? So we put the ad out, right, on ZipRecruiter or Indeed. You would pay for the ad, and then the resumes come in. We review the resumes. I do what's called a pre-screen. That pre-screen, in a nutshell, is a 5 to 7 minute phone call. I have a template that I use. It's a basic 10 questions to see if that person's worthy of an interview. So after the pre-screens, I would be selecting, well, it kind of depends, but we try to do maybe about 3 interviews. So from those pre-screens, we'll select about 3 people. It could be 2, it could be 1, because we definitely don't want to interview someone that's not qualified enough for you. So we would then do the interview. Once the interview is done, you would have access to the interview recording, the pre-screening template, the interview template. You'll be able to see all the information. Not only that, you'd see the interview recording. So you would see that person answering the questions that I'm providing during the interview, and you would be able to decide, okay, I do think this person is a good fit. So then what we would do at that point is we would do a second interview, which is more of a meet and greet, where Cody would be present, you would be present, that candidate would be present, and you get to know that person over an hour to an hour and a half, be able to provide and ask that person questions that you didn't really get and that you didn't feel was answered in the interview. They would have questions for you based on how you would want them to, how your vision is of how you want your clinic run, right? And then we would determine whether you want to move forward with that person. So the second option here is that admin manager will be exclusive to you. Now, I think the shared model is the best option for you, because if you do option two, you would be incurring the entire cost of that admin salary, which would be at least $60,000 a year. So that's $5,000 a month. Where the share model comes in is that we would pair you. So it's the same concept, right? We post the ad, do the pre-screens, do the interview, right? You would get, after the interview, the recording of the interview, the pre-screens, all the information, and the resume. We would do a second interview. The only difference is that you would be paired with 2 other franchise owners, okay? And all of you would collectively make that decision on who you would hire. And your cost will be 50% of the salary of that admin manager. So it would cut the cost down by 50%. So that will be your cut, okay? That admin manager would be hired and you would be paired based on where your location is. So now if your location is in Dallas, then we would pair you up with 2 other franchise owners in Dallas, because that admin manager would need to be physically at your location at least a couple times a week and rotate amongst the 3 franchise owners' locations. If your location is in Houston, then we would pair you with franchise owners in Houston. San Antonio, same thing. So that's how that dynamic works with the share model, okay? Now, the share model, just to get into this a little bit, right, and let's show you some numbers here. What we do with the share model is that we will, as I mentioned, we put the ad out, so we recruit, right? So if you look at this first bullet point, we recruit, we train, but we also employ that person. So that person would be on our payroll, right? And you'll be paying 50% of that salary. But they will be exclusively your admin manager and those 2 franchise owners, admin manager. There will be no other franchise owner involved with that admin manager. Now, the cool thing about that is not only is it cutting your costs, but that admin manager, you're not going to be on your own, right? There's 2 other franchise owners that will be working in unison with you to make that decision also, right? So it wouldn't be like you're just by yourself in making that decision. So let's go over some numbers. Any questions up to this point so far?
No, I follow you.
You're following me
No,
so
you've
far?
been good. Yep, absolutely.
Okay. Okay, awesome. Okay, so let's go into like some numbers here. So when I say 50% of the salary, do understand that we want to focus on how much, because payroll is one of the biggest expenses next to rent on any type of business. So we want to focus here on what the amount of money you're saving, the cutting of the cost, not so much like how much everyone else is paying or how much we're making, because you have to understand that the 50% employees monthly gross that you'll be paying, right? The money that we get off of that, we are putting it back into our management company to help with other areas like paying these people, right? They're going to get bonuses and raises, right? To keep these admin managers at your location so that you're not having turnover. So all these things are going to help build a culture that we want for all of our franchise owners, not just our specific locations at TedCare, but all of our people, our affiliates within a TedCare umbrella. So let's go through these numbers here. So you have your base salary. Let's just take an admin manager at $60,000 a year. Again, it's just an example, right? These are just numbers, an example. This is probably not going to be 60,000. It kind of depends on the expertise and qualifications of the person. To be honest with you, that range could be 60 to as high as 85,000. Okay, and some people even ask for more than that, depending on the qualifications and experience. But when we do the share model, it cuts that cost down by 50% for you. Okay, so we take the base salary. Okay, so for $60,000 a year divided by 12, the monthly gross is 5,000. Okay, now this person is going to be what's called a W2 employee. You do understand the difference between a W2 and a 1099, right?
Yeah.
Okay,
Yes.
so okay, so this is going to be a W2 employee because you want them to have not just job security, but you also want to make sure that you can have that person in, working the normal business hours and not be on their own flex schedule. But that's what a 1099 does, right? So you don't get that firm daily schedule on a 1099 because they have the flexibility to schedule their own hours, right? So when a W-2 employee comes into play, you do have payroll tax that comes in. So that's typically 10% of the monthly salary. And as a W-2, we don't have benefits currently. So I created a structure in place. Well, I mean, waiting for benefits through corporate. I don't know how long that's going to take. But when we want to get quality people, we have to offer benefits of some kind. So what I implemented with approval from Anton and Eric is a reimbursement plan. Think of it as instead of like your normal benefits that get deducted from payroll deduction, we just reimburse that back. So what they do is I actually think this plan is better because on a normal health benefit structure, when you work for an employer, they already have like their health insurance carrier picked out, and you kind of are stuck with that carrier. So they have Blue Cross Blue Shield, but you like Cigna or Aetna, like you're stuck. You got to use whatever carrier they have because usually employers don't have multiple carriers that they use. And then on top of that, um, you only have three choices for three plans. That's it. And you got to pick the plan that they offer you. Here, what we do is we offer the employee the chance to go to the marketplace and pick their own insurance plan. Okay. They have to provide proof of what they picked. Okay, so we have to have proof of whatever they picked, so that way we know what to reimburse. And we reimburse them 50% of the health insurance plan that they picked at a cap of $500 to $750 per month. That kind of depends on whether it's just for them or whether it's for them and their spouse or or them and their family. So if they pick for the whole family, it's capped at 750 per paycheck. I'm sorry, 750 per month. So if we take the example that the person is picking a health insurance plan, let's say that's $2,000 a month, then we will reimburse them $750 per month. So 50% capped at 750. Does that make sense?
Yes.
Okay.
Yes.
So at that rate, the total cost for that employee as an employer, right? As your employee, the total cost for you on your own, right? If you weren't sharing with anyone, you'd be paying the $5,000 base salary for the admin manager plus the payroll tax that's roughly, that's an estimate, about 10%. It could be 11 or 12%, but on average 10%. So that's $500, right? 10% of 5,000. And then the medical insurance capped at $750 per month, right? So that comes out to $6,250 per month. So that $5,000 base salary, what you're really paying is $6,250 per month for the admin manager. Okay, if their salary is 60,000, and this is just an example, we might end up having to hire someone with 65,000, 68, just depends on the work experience and the qualification of that person. Okay, your cut in a share model with 3 franchise owners will be 50% of this, so it's 31.25 per month, right? So where if you went at it by yourself, you're paying 62.50. Sharing in the share model, you're paying 31.25. Okay, yeah, yeah. Now, in order for your location to open, you need someone that's going to be able to do the assessments and treatment plans. That's what we call the clinical associate. Okay. The clinical associate is someone that's still in the process of getting their full licensure. So they're still under supervision from a full licensed clinical supervisor that's external to Texas Care. Okay. But we have a full-fledged clinical supervisor that is going to be signing off on those notes and diagnosing. They're the key to getting our reimbursements or the revenue that's going to be coming in, right? But we cannot put everything on this clinical supervisor because really the salary of a full-fledged clinical supervisor does all of this, all the assessments, like all the trainings, where you're looking at like $125,000 to $150,000 a year salary for that. Okay. So for us to curb that cost down and really try to find creative ways of cutting costs down for our franchise owners, we want to make sure that we bring in people at a lower rate. Okay. So the clinical associate, okay, is someone that's going to do the initial assessments and the treatment plans. Okay. The one that we currently are on, like as Antoine mentioned, we have one that's currently in training. Her salary is 69,000. These are real numbers here. Hers is $69,000 per year. Same concept, right? You have payroll tax, you have medical insurance. So when you add that up, her salary is $7,075 per month. If you were to go on your own with a clinical associate, you would be paying this. But under the share model, right, this would be how much you're paying, which is 50% of the salary. Okay. So really, when you add this number and this number up, you're getting 2 positions for the price of 1, because even with the admin manager, if you add 31, 25, and 35, you're looking at what, 6,600? That, I mean, that's close to just getting the admin manager on your own. But with a share model, you're getting 2 positions for that price, for that cost. So these are 2 positions that we currently have in the share model aspect. Now, we can go over this later on. This is like how the cost breakdown is. So you have a deposit that you pay. We kind of keep it to $1,000. That's due once the pre-screening is done for that candidate, and then the remainder amount. So, for example, if it's $31.25 per month for the admin manager, $1,000 deposit would be paid before we pre-screen, and then the remainder amount, which would be roughly what, $21.25, would be paid before we send out the offer letter once that person is hired. And then every 30 days, you'll be paying the $31.25 or whatever that 50% cut is, right? Because again, I want you to remember these are examples. This is not like what you would actually be paying. This is dependent on what the salary would be. So you'd be paying 50% of the monthly salary. And then that's how the cost breakdown. And then you'll be paying, your card will be debited every 30 days for that candidate. So because that is what we will be using to pay that person, because it'll be on our payroll. But they will be your admin manager. So that takes away from you having to handle payroll for this person. Like if there's issues, like we would handle all that. You wouldn't have to deal with that at all. There's a couple extra costs that come into this. Like they have to, like for the clinical associate, or any clinician, they have to go through certain certifications if they don't already have it. The CANS and ANZA and the nurturing parent certificate, when you add that up, that's like $500 total. and that's on the yearly certifications that are needed. So they have to renew them every year. The clinical associate also has to have professional liability insurance. That can cost up to $200 per year, so that's $700. We're eating that. We're absorbing that cost for you. You're not going to be having to deal with that. And there's one more component here. So I did talk about the clinical supervisor that has to diagnose and sign off on notes because they're fully a full-fledged supervisor. There's a separate agreement that we have for that. So we have one clinical supervisor currently, and what she's going to be doing is she's not only going to be doing the diagnosing and signing off on notes, she's also going to be training monthly the QMHPs that you're going to be bringing on board. So again, the QMHPs, those are qualified mental health professionals. They're the ones that are going to be going out into the community and doing sessions on a weekly basis for all the clients. They're going to be the people that actually are face to face with the clients on a regular basis. They're the ones that your admin manager has to regularly hire depending on when you reach a certain caseload. So the average caseload, meaning the number of clients that QMHP sees, for each QMHP, they probably won't be able to handle more than 15 people on average.
15,
12 to
15?
20 is the range, but on average 15. So, yeah, Cody, do you have a question?
Oh no, 15. You said 15, 15.
Yes.
Okay, gotcha.
Yeah, 15. And stop me at any point if you have any questions.
No worries,
You know,
man.
that way I can make sure they're addressed. But 15, yeah. So let's say, for example, you know, your clinic starts out slow. You have like seven. I would recommend starting with 2 QMHPs, one being bilingual at the very least. And let's say like you have, you know, you the first month you have like 9 clients, right? Started out slow. Second month you got another 6, right? You still have enough for those 2 QMHPs because they don't have a full caseload yet, right? So you're splitting it between the two. Now the third month you get like another 8 clients. Now you're at 23. So now you're kind of approaching that point where, you know, your 2 QMHPs are getting maxed, right? As far as the client caseload. So at some point your admin manager will have to recognize that we need to hire the next QMHP. So they will be trained, your admin manager will be trained on how to interview, how to post the ad, what to look for a QMHP, how to find a good candidate, pre-screening them, interviewing them. I would train them on all that, right? And then once they're on their own, as far as the admin manager goes, they will be working hand in hand with you, Barbara, in terms of determining when to hire the next QMHPs for your location to keep up with the caseload, right? So all those QMHPs that are being hired, they have to be trained. So our clinical supervisor trains those QMHPs on a monthly basis, right? So the fee that comes with the clinical supervisor includes the diagnosing that they do for every client, signing off on notes on every client, the QMHP training monthly, the initial training that they'll be providing for the QMAPs, right? Any assistance they need from a clinical standpoint, right? The clinical supervisor will be providing that. Your admin manager will be the main point of contact for them, for the QMAPs, but any clinical assistance they need, they would need to go to the clinical supervisor. Okay. Other things they'll be helping with would be the clinical associate does the initial assessments. We'll be bringing more of those on because they can only take on so many clients. At some point, they'll be capped, so we have to bring on more clinical associates. So those people need to be trained by the clinical supervisor too, right? So all of that, so we do have to pay the clinical supervisor. Now, what corporate is doing is corporate is charging you. You have the option of going to corporate to get the clinical supervision and the clinical assessment. You can do that. The only problem with that is that they will provide the initial assessment, the clinical supervision, all of that. You pay them $2,000 per month per location, but they cut you off after 90 days or 30 clients. So once you reach 30 clients or 90 days, you're on your own to get your own clinical supervisor. And that clinical supervisor has a salary of at least $120,000 a year. Okay, just to give you perspective. what our clinical supervisor agreement shows is that the first 60 days, and again, the clinical supervisor is going to do all those things that I mentioned up above. Is there any question about what the duties are, what the supervisor does? Is that clear, or was that?
Yeah.
It is,
Yeah.
okay. Right. So now that you understand that, there's two ways to do this. You go to corporate, pay them $2,000 per location per month, and you get that. But then after 30 clients or 90 days, that's it. You have to get your own clinical supervisor. Now, like within those 90 days, you have the headache of having to hire one. Not only having to hire one, the salary for them is six figures. You might be able to get one that's 90,000, but you're doing it on your own. Okay. Whereas what we offer with our clinical supervisor agreement is that you get all of that, right? The signing off on the notes, the diagnosis, the training of your QMHPs, all of that, based on this chart. So from day zero, right? Day zero meaning you're not open yet, but your QMHPs have to go through training, right? So from that point to the point where you're deemed open, because corporate will tell you when you're deemed open because they have to go through this checklist, up until the first 60 days, your cost for the clinical supervisor is $750 a month. Okay. Now we're able to do this because we have multiple franchise owners that will be paying this. So we're able to take that be able to pay our clinical supervisor enough to where it makes sense for her to do this for us, right? Because we have the network within our TEDCare umbrella to do so. You wouldn't be able to pay $750 to get clinical supervision on your own if you hired your own clinical supervisor. Okay. Now, the cost does go up as the number of days open. So the idea here is once you're between this day 61 and 4 months, you should have revenue coming in and a decent number of clients. You should be over 20 to 30 clients at least by your fourth month, right? Even if you're going slow. Okay. So then your clinical supervisory fee goes up to $1,250, and then 4 to 6 months it goes up to $1,500, and it capped at $2,000. So while corporate is telling you to pay $2,000 for all this per location per month, they cut you off after 30 days or after 90 days or 30 clients. We cap it off at $2,000 per month, but not until you're past the 6 month stage. Okay. But then it doesn't go higher than that. Whereas like if you got your own clinical supervisor after the first 90 days, you got to get your own and pay that salary. You would never have to pay for clinical supervision more than $2,000 a month. Now, I will be transparent with you. We are kind of still working out the kinks on this. Like I'm talking to Anton and Eric about potentially putting a fixed rate on our clinical associate. That's the shared model up here that I showed you earlier, the one that does the assessments. We are contemplating like doing a flat rate on that within the clinical supervision agreement, where that would be 3,000 flat. And so for the entire supervision, including the assessments, like everything clinical, right? Everything clinical would be $5,000 per month at its peak. So it'd be 3,000 plus 750 for the first 60 days, 3,000 plus this for the month 2 to 4, $3,000 per month plus 1,500, and then after 6 months, it will be $2,000 for the supervisor and $3,000 for the clinical associate. So for that, you're paying $5,000 per month. Whereas like if you got a clinical supervisor to do all of that, you'd be paying $10,000 to $11,000 per month. So
And something to just add in here real quick,
Yeah.
Just so you guys know, this all seems like a lot of money, but you have to remember that the QMHPs, for one, are paid based on the amount of clients they see and billable hours. So you don't
Correct.
pay them, except at the very beginning when they're training and stuff, you don't pay them until they actually see the clients and they bill the hours. So you pay them after you're reimbursed, right? On the supervision part of it, we actually do get reimbursed for those assessments and for those treatment plans. And that number that we're getting reimbursed for is more than likely to it'll make money instead of being out of pocket for it. So all of these expenses for like the LPCA and the supervisor, you will get reimbursed, you know, for all those assessments and treatment plans, which will probably be greater than what you're paying them. So just so you
Yeah,
guys
so
are
the
aware of
idea is
that.
that you're going to
Yeah.
have a net profit off of all of this, right? But the bottom line is you have to have these salaries in place, or like the payroll to operate in place. The other thing that Anton, just to pick up on what Anton just said, is, you know, so with this model, right, with everything that we're telling you, you're paying less than what you otherwise would pay if you're doing it on your own. So the goal here is to create a model that cuts costs down for you, but all the reimbursements that Anton's talking about, we don't take any of that. It goes directly into your location.
Uh-huh.
So while corporate may have like a fee, right? Where, they may be taking certain amounts of reimbursement. I don't know how they're doing it. We're not taking any of your reimbursement. So once you're reimbursed, that goes directly to you. Because when the clinical supervisor signs off on the claims, it's signed off for your location. And so when you do the agreement is that you're using our clinical supervisor for your location. So the clinical supervisor is going to be credentialed for your location. And so hence you're going to be getting the reimbursement.
Got it.
So yeah, I mean, like Anton said, we are talking about, like, you're paying 2,000 here, you're paying 3,000 there, you're paying 3,000 over there. But we have to understand that you have to pay your employees, right? But the idea is let's find a way to cut the cost down so you're not having to pay those people their full salary,
Which is
right?
great.
And the reason why we're able to do that is because it's simple, like strengths by numbers, right? The more franchise owners we have, the more we can spread the cost and allow our franchise owners to be more successful by allowing the reimbursements that you get to give you a larger profit margin.
And that's why, you know, the initial funds that you need to do to operate, really those funds are there to operate for, you know, the first, 1 or 2 months until you get to the point where you have enough assessments coming in, enough, clients and stuff coming in, where that reimbursement is going to continue to catch up to the amount of money that you put in at the beginning. And the reason why we also kind of created this and is because Asif is an amazing trainer. He's very good with, building a team around him, and he's done it before. And having the consistency with the training, with the processes, and with the, all of the SOPs, and then, we've built out the entire backend system with our CRM as far as we have a hiring pipeline, which every person that gets hired goes through the same exact process. We have the same exact, guidelines for each one of those people. They know exactly what to expect. And then, Asif and myself and Eric will always be there for support. Even, once we hire this admin for you, it's not like we just don't talk to them ever again. We're always going to be there for support if they need anything. Let's say they call out sick. We will find somebody to take over and to, do the billing for that day, or, whatever the case may be. We have the
Yep.
same exact pipeline for the clients, where we've built out a system where, with our landing page, and we have a chat bot on the website, and we've created a intake process and a consent form process to make sure that each one of our franchise owners gets that same exact process across the board, so that you guys, every single one of our franchise owners, knows exactly what that process is, what to expect, and knows exactly what to do. So any one of our admins can fill in at any other location whenever we need it, because everything is always the same across all 48 of our franchises, right? We also have the same exact pipeline for community outreach we're building. So when we're reaching out to schools or nonprofits or apartment buildings or, organizations, government centers, courts, we're going to have all of that database inside that same system, where we all are going to have access to that and it's going to be the same across the board for that. So that's what's really cool about this shared model and what Asif's put together. I helped a little bit. He only kept me up till 2 a.m. A few nights in a
No, it
row.
was a
to do work,
collaborative
but-
effort. Trust me. Like this is something that this was worked on together. So
Yeah, but yeah, I just wanted to explain that real quick so you guys understand, why this process is so awesome and that we're really excited to kind of, get it going and stuff like that. So yeah.
and also Cody, and Barbara, just to add to this, there are other aspects to the service that will be provided that's not on here yet. So we do have one of the biggest things for Texas Care that's really crucial is we're community based. So we have to have a system in place where we're doing community outreach. Now, of course, corporate does provide support on community outreach to a certain degree, but it's there's issues there as well because some of it has to deal with the bandwidth, meaning how much they can support with so many number of franchises that are coming up. But also, how much, how they're going about doing it as well, right? The organization of it. So we've taken it upon ourselves, because we have, and are we we're not the largest anymore, right? But we're up there as far as the
No,
largest entity.
I think so. I think we own close to like 45% of the franchises.
Andrew said it was a little bit less than that right now, but I mean, it's going to go back up because we're starting to really ramp up on bringing new franchise owners in. Right?
45%, you said?
It's not
Yeah.
45%.
Well,
It's
You
not.
guys
at
are
one
going
point,
crazy.
at one
At one
point,
point it was.
Okay.
yeah, I think we had there was 100 franchises total, and I think we have 18, and I think there was like 24 or 25 that we've brought under. So I think it was, what is that, 43?
It's
Yeah,
like a
43
third
was
right now, I'd say, until like 40 out of 120, I would say, on average,
Yeah,
roughly.
I think they were gonna bring in the 20 franchises, but I don't know if it went through yet. It might have fell through, but I don't know. But it was like 120, but
Yeah.
I think that was with the addition
So
of like 20 that were gonna come in. So
yeah, so Barbara and Cody, just know that like we have we are like in the top three. Let's just put it that way, for
Yeah.
sure. In terms of having like the amount of franchise owners that we brought in under our umbrella, and of course you guys are, or Barbara, you're one of them. So we're always trying to add things to, and I'll be transparent with you. This management company did not exist in April. So all this that we put together has been through brainstorming. So I was brought on board just to give you like a short background. So I met Anton and Eric like in early November. I actually came as an investor, like with shares. Mid-December is when Anton came to me with the um, offer of being his admin manager. End of January, we met for the first time. I met Anton and Eric. We had like a huge corporate get together, and I met them at corporate with a lot of other people. And February and March, I was trying to figure things out. Like I was not very vocal. I was not in the forefront. I was trying to figure out how things are, operate, trying to understand the process, like really leaned on a lot of people that are like, admins that are currently open, which is really like one or two that I leaned on, asking questions, sitting on meetings, trying to piece things together. And then around the last 2 months really is when I realized, where the gaps are, how the processes work, starting to put things together in a way that would help our franchise owners. So this management company started like in the last 30 to 45 days. But it's really come together quite a bit over the last 30 to 45 days. So there are other things that we're implementing and will be implementing over the next 30 days. One of them being, as I mentioned, something that's very, very crucial since we're community based, and that's community outreach. So we do have an events planner that is currently learning as she goes. So once she really gets her feet wet and stable, we're going to be creating an option within the management agreement that allows for events planning and community outreach. And that option will have, from what I can see, there'll be multiple options there that allow you to just do community outreach or do X number of events per month, which will help you and your location bring clients in through those events, right? So those things are also in the works in terms of being developed. We're also adding other, we're looking at other things as well, which I won't really go into, to help our franchise owners have a more seamless process from the very beginning, all the way to when they open and beyond. So this is just, talking about hiring, right? And then staffing, but there's gonna be much more to that as well, where as far as the support that you'll get from us.
Makes sense.
Yeah.
Right.
Did you guys have any questions at all?
Guy is a beast at explaining things, man. He did great. So not really. I guess the only question that I have is, okay, so once she hands the keys over to you guys, how long do you think she could generate her first, like when will her first client, when would that play out?
Yeah, I can kind of go into that a little bit. So, um, it's really a tricky. It's really tricky in a sense because some of the
I guess
locations
based
that are
on the
open,
amount. Oh, okay, yeah, you could go
yeah,
ahead.
yeah,
Okay, okay.
yeah, some of the locations that are open, um, it depends on how long they've opened. So, for example, I can give you some numbers here. One of the locations that was open 6 months ago was one of the first locations that were open. And also, mind you, also understand this, that when we say there's over 100 franchises in Texas Care, that's in terms of they're still under the accreditation credentialing phase, and majority are not open yet. So I can count like on two hands the number of franchises that are actually open and running. And I would say out of those, only on one hand would I count the ones that have been open for more than 3 months. So the one that's been opened really the longest that I would say actually has been consistently in operation and not just open and just sitting there, would be a location that opened like around October, November, and they currently have 93 clients from the last time that I talked to that owner, which was about 2 weeks ago. And they got 93 clients over a span of 6 months,
Yeah.
right?
Yeah. You also have to remember too, when they first opened, Jessica, who is their admin, we've been leaning on her a lot. She's amazing as well. So, they first started, it was one of those things too, where they were learning and stuff. And the first 2 months were really slow, right? The first 2 months,
Right.
I think they did, the first month was maybe, I think, like 7 kids, right? The second month, I think they got up to like 25 or 30 kids. I think it was like even 20,
It's a
25.
gradual increase.
Yeah, but then the last month, from month 5 to 6, I think they brought in like 35 or 40. You know what I mean? So it
Yeah.
went from like just going really, really slow to getting bigger and bigger, and it kind of compounded because a lot of times what happens is you start to bring these families in and these mothers or fathers, and they start to refer other people, and then
Right.
you get 10 more, and then those 10 refer each two, and then it becomes like a built-in referral network because every one of
Right. Yep.
these parents wants to see their friends and family being helped, and so on and so forth. And not only that, they just get better at what they do, right? So as them being the first one, we're all learning from them, and we're taking little bits and pieces of what they do and expanding on that, and really, you know, everybody's getting better and better as we go, and as we're working on things as a team. Everybody's improving as we go every single day. Just sharing information, sharing ideas. We just got done working on our landing page, making sure that that's approved through corporate, making sure that it's all compliant, making sure that the wording is right. Our flyer we just created is awesome. Asif did a great job on that. Making sure that it's, formatted correctly, making sure that it's in high quality. There's so many little different pieces to this that we've done, building out our systems in the back end. A lot of that stuff, when we first started this, we were handed a bunch of, Google Docs, and we're like, oh, here you go. And we're like, okay,
And
I
that's the
guess
thing.
we're gonna figure this
Yeah.
out.
And that's the thing, like what Anton just mentioned, the learning curve, right? That learning curve that we went through is going to be somewhat shortened for you. Even though everyone is going to have a learning curve for their location,
Of course.
but each location is its own entity. Like I mentioned in the beginning of the call, demographics, socioeconomic status, each location, each area is a little bit different. You have to kind of feel out. There's a feel out period to kind of figure out what's working, what's not working. But that period of feeling out that, let's say, the location we're referring to with the 93 clients that they had to go through 6 months ago, even what we've had to go through, in terms of, even though we're not open yet, but the kinks and things that we have to go through, it's going to be more streamlined for someone like you because you're coming in after all of this, right?
Okay.
And the people that come in after you are going to have an easier time than what you go through. So it's going to, like Anton mentioned, it's going to be constantly improving, but there's going to be a little bit of a learning curve based on where your location is. But going back to your question, Cody,
Yeah.
as far as like when she should be able to see her first client, it's never too late to start community outreach, right? So getting your name out there. But you can't do that either until you have a location set up so that you know where to do the community outreach. What
Yeah.
zip codes do you go into, right? So that's the first thing. Location, location, location is the first thing because you can't do anything without that. After that, it's a matter of reaching out to churches, reaching out to nonprofits, going out and just like introducing yourselves, right? Barbara could do that over the phone. She could make phone calls from where she
Mhm.
is, and reach out to some of these entities, right? You just go to Google and kind of look up some of those things. But that's where the admin manager that you hire is going to really come into play and work alongside Barbara to do those things for her. Like Barbara would, tell her, hey, tell him or her, this is what I want to kind of, this is what my vision is, this is how I want to kind of approach this. What are your thoughts? And then that admin manager will be able to take that and be able to do those things and try to build off of that.
Got it. What are
But
the
part of
what
this
are,
is also going to be, you know, not just starting community outreach as soon as you can, but also making sure that, we have events set up, you know, before you're ready to open so that we can kind of get some client names, like a list of some names in the beginning. But again, we can't do all of that until you're closer towards the period of where you're going to be opening.
what is the maximum capacity that an individual clinic can handle?
Yeah, good question. So according to corporate, they came up with the number of 150. So when you look at that number, you're like, okay, there's gotta be like, I mean, we should be able to get 150 people, like, you know, in a certain area, right? But I think that number came up just arbitrarily. It's not like it's a Medicaid guideline or a specific corporate guideline. They just came up with that, I think, because they feel like when you go beyond 150 clients, then you're putting, like, as far as the number of staff that is required to fulfill any number of clients above 150, you're kind of getting too big within a
Yeah.
location. That will be the only thing. However, as long as you can continue staffing the QMHPs to be able to handle the caseload, there's nothing written anywhere that you can't go to 175, 200, 250, 300.
Interesting.
Yeah, and really the reason why they said that is the 150 mark. You get to the point where you have the amount of employees that you need. What Andrew said, and it really all depends on the type of culture that you are, instilling in your employees. But he says sometimes drama starts to happen, and QMHPs might start getting along or becoming romantic, or whatever the case may be.
Yeah.
And I think that's where sometimes he said that things can get a little iffy. But in my opinion, I think that as long as you have a good culture and you build a team that gets along and that is, good people, and you train them well, and I think that you can go above that 150 in my opinion, but it just really depends. I don't think corporate's going to stop us if we have 200 people, 200, and everything is going fine. I think that we'll be able to kind of see what that's like when we get to that point, which will be a good problem to have.
So it's like a potential sustainability issue, but it comes down to the individual franchise owners and how they handle their
Right.
business. stuff like that.
'Cause at that point, also, Cody, remember you're gonna be independent from corporate, although you're still gonna have to pay the royalty. The royalty fee behind it is because you're paying for the brand, right? So corporate is building that brand up. That's one of the things where Andrew, our CEO, is very, very good at, which is building up the brand. That's like where his expertise is. So as he builds up the brand, that value that you're paying for is going to increase. Like whatever that franchise fees that you paid, it's going to go up over the years because of branding.
Yeah.
So people, as they know MD Anderson, right? As they know some of the Cody, where are you located?
Jersey.
You're in Jersey too. Okay. So like, what's the most like what's your most common like your largest hospital where you are?
Christ.
Okay.
Huh.
Okay. But you know, like let's say we look at let's say Mayo Clinic, right?
Oh, that's
That's
right.
a household name.
Mm-hmm.
You know, you can't go anywhere and not and say Mayo Clinic and the person doesn't know what you're talking about. You know, so the idea is to make Texas Care the household name within Texas for behavioral and mental health, similar to how MD Anderson is the household name for cancer research and cancer um, treatment, just like some of our other facilities in Texas are a household name, right?
Mm-hmm.
That's the goal. It takes time, but once that brand is built, then the idea is that we won't have to reach out as much. People will come to us.
Mm-hmm.
That's the vision, and that is what we're trying to build, but it takes time.